Hi, I'm Katie, EleMental Health's Ketamine AI. In this video, we go over the detailed long form of the general ketamine consent for our audio learners. Ketamine general consent. Ketamine has been approved for use in humans as an anesthetic agent and has been safely used in clinical practice for nearly 50 years. Ketamine belongs to a class of drugs better known as NMDA receptor antagonists. It is one of the most widely used anesthetics in the world. We utilize ketamine to address symptoms of depression, anxiety, OCD, PTSD, pain conditions, fibromyalgia, headaches, and more. These specific courses, dosing, and approaches are covered during a provider consultation. Utilizing this approach and a dissociation-based protocol sets us apart as a clinic. We create a customized alternative medicine, CAM, approach for each client. We use hospital-grade pumps and central vital sign monitoring systems for ketamine administration. We also adhere to the ASKP standards of ketamine administration and their code of ethics. This consent is in force for the duration of your care. When you schedule, we do accept this as an assumed consent to resuming care if there has been a gap in your treatment. We may require periodic updates to signed consents. There are additional documents attached to your consent detailing discharge instructions, session expectations, maintenance, patient rights, and billing questions, covered in another video. Alternatives. Alternatives to ketamine include continuing with an oral medication, changing medication regimen, various therapy options, intensive outpatient programs, procedures such as TMS or ECT, or hospitalization. At the doses given in this treatment, ketamine poses minimal risks or discomfort. Risks and discomfort. At higher doses, ketamine has been known to cause salivation, increased cardiac output, and may alter your ability to think, also affecting your perception and judgment. Short-term psychological events, such as visual hallucinations and dissociative sensations, occur in up to 80% of ketamine recipients. This is expected and normal. In addition, delayed ketamine flashbacks have been reported in some patients. Ketamine is one of the most commonly used anesthetic agents in emergency room and pediatric settings. It has a wide therapeutic index and is considered a safe, well-studied, and well-known drug, having been used in anesthesia and pain widely since the 1970s. Routes of administration. IV. A peripheral IV is placed and removed each treatment. Risks associated with this are bleeding, bruising, swelling, IV infiltration, pain, nerve damage, and infection. IM. An intramuscular shot is administered. You may have muscle soreness or tenderness. Oral. Oral lozenges are dissolved through your mouth. You may experience nausea. Nasal. Nasal racemic ketamine or Spravato is used. You may experience a mild burning sensation, runny nose or watering eyes, or unpleasant taste in your mouth. The most common side effects of ketamine administration are outlined above and apply to all routes of ketamine. This list is not all-inclusive. Session experiences, timing, and exact process will vary. Ketamine reveals your psyche to you in a way that feels comfortable to work with for most people. We cannot and do not guarantee the content of your psyche, nor your comfort with approaching this aspect of yourself. We suggest joining our virtual group prior to sessions, if you'd like to get therapeutic guidance on what to expect from this non-ordinary state of consciousness. Timeframe. Timeframes are subject to change and may be adjusted due to patient-specific needs. They may be accelerated or decelerated depending upon the patient's response to treatment, or lack thereof. This protocol has been established to give the patient a generalized idea of what can be anticipated from a time and cost perspective. Of course, each patient will be evaluated and treated as an individual case. Post-treatment. The recovery phase is typically 20 to 30 minutes, more time available upon request as needed. During the recovery period, the patient's vital signs are monitored by your treating clinician until they have returned to baseline. It may be 5 to 45 minutes of post-session monitoring. How quickly you return to your pre-session baseline varies, and you meet discharge criteria when within 10% of your starting blood pressure and heart rate. If you would like one-to-one therapeutic guidance during your sessions, or a one-to-one person to stay in the room with you while you journey, or you feel you would benefit from a historian present during your experience, Please sign up for one of our ketamine-assisted therapy options. Indemnification. You agree to indemnify, defend, and hold harmless EleMental Health, its officers, directors, contractors, employees, agents, and third parties, for any losses, costs, liabilities, and expenses relating to, or arising out of your use of, or inability to use, the site or services, any user postings made by you, your violation of any terms of this agreement, or your violation of any rights of a third party, or your violation of any applicable laws, rules, or regulations. EleMental Health reserves the right to assume the exclusive defense and control of any matter otherwise subject to indemnification by you, in which event you will fully cooperate with EleMental Health in asserting any available defenses. In plain language, should you choose to not follow clinic recommendations about your care, you release EleMental Health and associated entities from liability related to your personal choices. Medication side effects. Ketamine. Increased blood pressure, anxiety, alteration in mood, visual hallucinations, vivid dreams or illusions. Sedation and fatigue are also side effects of this medication. You are advised not to drive or operate heavy machinery for 12 hours after you receive this medication. Ketamine has been known to cause salivation and increase cardiac output. It can also alter cognition, affect, perception, and judgment. If you develop cardiac problems, the treatment may be discontinued. Ondansetron, Zofran. This is administered for any nausea that you may have. The potential side effects of this drug are headaches, constipation, and fatigue. Meclizine. This is an over-the-counter medication that helps treat motion sickness, which can sometimes occur with ketamine. Labetalol. This is an IV beta blocker which is used to treat high blood pressure. It lasts about 20 minutes and is given as necessary. Phenergan. This antiemetic is used when Zofran and Meclizine fail to prevent nausea. There is a risk for vein sensitivity or irritation. This medication is given diluted or injected into a muscle. Additional medications may be administered to treat the adverse effects of these medications as necessary, including drugs used in emergency resuscitation. Please contact EleMental Health or your primary care provider if you have any problems post-session. These medications are being used off-label, which means it is without FDA approval for this specific use. Even though ketamine is an FDA-approved medication, these uses are not included on its label. Insurance will not cover ketamine sessions, and payment is expected in full at the time of service. For insurance-based care, you may also be charged a copay if it is required by your insurance on the day of service. You may opt to use insurance benefits for psychiatric intake, consults, follow-ups, or medication management services. These services are run through EleMental Health, interventional psychiatry, and we do not guarantee insurance coverage and do not reimburse insurance payments collected, except in cases of overpayment. The initial treatment can be bi-weekly, weekly, or monthly, depending on my specific case and history. You will receive an estimate of how many treatments you may need. Ongoing nature of maintenance sessions is required for all forms of ketamine. Please pay special attention to the following. Maintaining a response may require repeated treatments over the course of time. Most patients receive treatment for 1 to 2 years and engage in ongoing maintenance of every 2 to 6 weeks on average. Many people feel worse before they feel better, and this is normal. You agree to contact your mental health care or pain provider for any concerns that arise during this course. You agree to present to an ER or higher level of care if you become a danger to yourself or others. There is a very small, less than 1%, chance of bladder damage. You agree to consult with a urologist at your expense should this occur. This risk is most commonly associated with oral or illicit ketamine consumed in large amounts. The possible side effects during treatment with ketamine include increased heart rate, transient high blood pressure, feeling unreal, mild hallucinations, confusion, blurred vision, or general anxiety. These are generally short-lived and well-tolerated. There are no guarantees concerning my response or rate of relapse. The scientific research on ketamine for this use is still in the early stages. The current data show ketamine to be safe and quite effective. In rare cases, ketamine treatment has resulted in a patient having a manic episode. Ketamine is not safe for fetuses or infants. If you are a person of childbearing age, you should not seek care while pregnant. If you do become pregnant, please let the office know immediately. It is not possible for this consent to be all-inclusive, and you assume any and all risks of proceeding with a ketamine course. You have been informed of the common reasons and approaches for this treatment. The best possible outcomes require engagement in psychotherapy and lifestyle changes. There is a low potential for addiction with ketamine, even when given in a controlled setting. Common risks of IV placement include mild pain or discomfort, bruising, infiltration, and/or phlebitis. Very uncommon risks include air embolism and arterial injection. Rarely, the IV site may stop functioning during my treatment, and a new one will be placed. For your safety, infusions are monitored with security cameras and a central vital sign system, but are not recorded. Ketamine may interfere with your decision-making capabilities for up to 24 hours after sessions. You agree to not drive a car, operate heavy machinery, watch small children, or make legal decisions for 24 hours post-session. Long-term side effects of medical ketamine infusions are not entirely known. Cystitis and cognitive impairment have been described. We now know the amount of ketamine required to produce these complications far exceeds dosing used in controlled clinic settings. We do not know of any long-term negative effects with office-use doses. You must agree to not engage in using multiple forms of ketamine. No use of illicit ketamine is tolerated. You must not engage in home-use ketamine, as this is significant risk to your safety and well-being. You will be discharged for using ketamine from any other prescriber without prior agreement. Please inform EleMental Health should you need to travel or use another clinic for maintenance. EMS will be called on your behalf in case of emergencies, and any costs incurred are my responsibility. Please ensure you have had your treatment options explained to you and have had all of your questions answered prior to proceeding. You consent to communication via text, email, and phone call. Appointments are scheduled via Acuity, and you agree to review these appointment-specific guidelines. You agree to resolve any legal concerns through mediation with EleMental Health, and will attempt to resolve complaints or concerns in good faith first. You may consent to have this data used anonymously in research studies to further this field of work. This treatment does depend on the work you put into it as well. No consent will be all-inclusive of every possible risk or outcome. The most common topics are covered here, and you accept that there may be individual variances or risks that are not possible to cover here. You assume the associated risks of establishing care and utilizing these services. The clinic adheres to standards of practice, policy and procedures, and ethical standards, and these things are within the clinic's control and guarantee. The clinic cannot control how you experience or feel about entering a dissociative state of consciousness. Please provide us 24 hours notice for appointment cancellations or change requests at 208-510-0000. You may pay by the session and may cancel at any time. You will be refunded for any unused paid sessions. We do not offer refunds on completed sessions. We can go over any of these topics in detail during your consultation. We hope you have found this consent overview helpful. We are here to help, and consults can be scheduled by calling 208-801-1414.